Hi guys, it's Dr. Diaz again. We have Robin here today. So she's come in for a few visits now. She came in with a lot of upper back tension, tightness in her neck. She goes to the gym here at Gold's Gym, and her issues, I go to work out, I just can't feel any relief. I have headaches. I just have a lot of tension. I can't get any relief at all. She's had different forms of therapy before. So we came in here and she said, hey, what can you do? How can you guys help me? So throughout our visits, and we've discovered a few positions that are a little non-traditional to set the table up in, so we're going to show you those today. So a little bit of history on her. She has a condition called, or had a condition called Chiari Malformation. So this is where the bottom part of the brain, of the cerebellum, the sinuses protrude down past the foramen magnum, so they get caught down into the neck area, the upper neck area here. We're moving the table a little bit here. And so as they get caught in the neck area, they're going to have some symptoms. So when we have stretching or sneezing or coughing, it presses on that malformation, and then you're going to have symptoms like dizziness. She had seizures. You can have tremors. You can have extreme neck pain, fainting, so on and so forth. So in her situation, she was having the fainting, the seizure, the whole works. Everything was going on. So now they've done surgical repair. So now with surgical repair, we're maintaining the sinuses of the cerebellum and the brain stem. So now at this point, she's searching for therapeutic rehabilitation to help her kind of keep her muscles relaxed and help her keep functioning. So today we're going to show you guys a little bit of how we set her up. We use some electronic stimulation. We set her up with a traction-like set up on a table. We're going to show you that. Right after that, we're going to jump into a chiropractic adjustment. So let's have you stay right where you're at, and we're going to set you up here on the E-stem like we normally do. So I'm going to set up, there are 4 here on top, and then 4 right in here. Or would you like 4 low back?
No, uppers.
Upper? Okay. All right. So we're going to set up some stimulation right in here. Okay. Are you okay with showing the repair? So if you see, you'll see the repair right here. They open this up. They make a repair to keep the sinuses from moving down to the foramen magnum, and you'll see her surgical scarring here. So once we do have this type of scarring, this type of soft tissue scarring, we got to understand that the scar not only is the superficial, it's penetrating all through multiple layers of fascia, muscle, so on and so forth. So now the proper muscle movement is not going to be there anymore. She's going to have a lot of knots, a lot of tension, tightness, so on and so forth. So with these types of injuries, surgeries, so on and so forth, it is ideal to receive this type of chiropractic care, soft tissue manipulation, so on and so forth, to maintain better muscle movement, better muscle flow. All right. Set it up right in here, okay, and we're going to set some offset traps here, okay, right there. Guys, if you like our videos on Facebook, YouTube, Instagram, like us, share us, comment, tag your friends, we greatly appreciate it. Let me have you bring your legs around this way for me, and let me have you lay face back down right there for me, okay, and then you're probably going to want to scoop just a tad that way. Right there's perfect. Okay, very good. All right, so we're going to set up, like I said, this is a very non-traditional setup. I've set up now, actually, after her, a few patients, but before this, I'd never set up the table this way. We just discovered that felt pretty good. She was kind of telling me, I just feel like I need a stretch, and this is what I need. So we tried this, and it seems to help her. Okay, let's set up right over here. Okay, so we're putting her into an extension. Okay, very good. And stretching?
Yeah.
How's that feel there?
That's good.
So can you, I know you're looking up here, but can you tell us how therapy has helped you?
Since my first visit, I feel less tightness around my, call it the hanger area, kind of in my neck and in my shoulders. I'm going to stop and then tell you when in a minute.
Okay, you tell me when.
That's good.
Good. Here comes the other one. You tell me when.
That's good.
Good. So less tightness in the upper back hanger area, neck
and
area?
in my shoulders.
Yep.
I have better movement. of my neck, without pain. I have constant headaches and debilitating migraines, but I have fewer a day, so that's good. And I'm taking less ibuprofen and Tylenol. I do take seizure meds. That helps with the tremors that I have, and that also helps with the migraines. And I've noticed that I do better with the medication. I thought I had to increase my meds because I'm able to adjust between a certain amount of milligrams, and I haven't had to feel like I needed to adjust.
Very good.
Coming here, I've had to use less heat and ice when I'm at home. And I'm able to tolerate light more. I noticed that I'm not as sensitive to light as I usually am. And overall, just feel loose. I'm not as tight and as tense.
And we've seen you 4 times?
Yes.
Okay, so this is after 4 visits. We're talking about a condition that has caused her lots of issues. As you see, the medication that she needs to be on, the type of at-home remedies that she's having to apply. We've seen diminished pain, diminished amount of migraine, diminished light sensitivity. These are huge changes, guys. These are huge changes in the symptoms. Chiropractic helps. Chiropractic works. Right now, like I said, we're setting her up on electronic stimulation to relax the muscle a bit. We have her in this traction type position. Once the machine is up, we're going to come back in here and provide chiropractic adjustment. We'll see you here in a bit. So we've already gone ahead and done some electronic stimulation. We've had her on this traction. How'd that traction feel for you?
Felt great.
Felt great. So that's what reports she's given us throughout her first few visits, and so this is kind of the approach we set for her. Now we're going to set her up. We're going to do a little bit of soft tissue work on her upper traps and shoulders, and we're going to provide chiropractic manipulation in the cervical region. Sorry. I do want to explain that the first day she came in, she said, "Don't touch me."
I did.
Right? Yeah. Now, over time, she's come to realize how effective chiropractic has been for her and how non-invasive and non-painful it is. So now she's experiencing a lot of relief. You may, during the adjustment, may hear her maybe kind of get a little nervous during the adjustment. It's okay. This is going to be something we deal with on an everyday basis. So we're going to get in here. We're trying to relax some of these muscles here.
Still so tight.
Yeah, they're really tight here. In our clinic, we do have a massage therapist that we recommend for combination of chiropractic and massage therapy. I also get in here and do some soft tissue work to loosen stuff up before I adjust. So we are having combination of soft tissue work and chiropractic adjustment along with electronic stimulation, vibration plates, so on and so forth. Relax right here for me. We're going to get some movement here. Very good. Okay. Relax right in here for me. Very good. Good. Excellent. Okay. Good movement. Very good. Okay, we're going to have you relax right here. We're going to pick the table back up here. We're going to bring the table back to set up, so just wait right there for a little bit. Okay, very good. All right, let me have you lay face down for me.
Okay.
Excellent.
Okay.
Good. Okay, we're gonna fix the little drop table that we had used here. Okay, very good. All right. I'm going to use a little blue machine right up here, okay?
Yeah.
All right.
I love that blue machine.
Little blue.
Yeah, I love it.
When you first came in here, did you ever think we were going to be getting that much movement in your neck?
No.
Not at all. She didn't want it touched, and we've made a difference.
Yes.
Take a deep breath for me. Completely exhale. Very good. Okay. Take a deep breath. Completely exhale. Very good. Get a little bit of movement in here, okay? Very good. Very good. Okay. Breathe in. Completely exhale. Very good. Breathe in. Completely exhale. We're getting full spine movement here for her. Tender.
Yeah.
Okay. I'm gonna drop the table just a tad more. Let me have you lay on your side facing this way for me. Okay. Excellent. Let's have your top leg bent, your bottom leg straight. Bring your arm right over here. We're gonna get some movement right in here. Take a deep breath. Completely exhale. Very good. Very good. Lay facing the opposite way for me. Good. Same thing here. Top leg bent, bottom leg straight. Excellent. Very good. How are you feeling right now?
Good.
Good. Breathe in. Completely exhale. Very good. Excellent.
Okay.
Very good. Thank you very much. I'll help you
Yeah.
up here. And we look forward to your next visit.
Yeah.